Hi, I'm Molly. I'm one of Dr. Biesman's nurses, and I work here as a nurse, but also as an expert in injectable fillers. This is Jana. She's going to be our patient today, and we're just going to talk through some of the options that we have available for soft tissue fillers that we can use in different parts of the face, which products we prefer to use in different areas, and Jana has been willing to work with us today. So when I do an assessment on a patient, I like to start kind of working from the top down. So typically, the eyes are an area where people find that that's one of the first areas that they notice that they're starting to see some signs of aging. So we often look at, there's a demarcation line that you can actually see. You can actually see where the lower eyelid meets the cheek. And normally in a youthful face, which Jana actually, she has a very nice transition through here. There's a really soft transition from the lower eyelid to the cheek. It's nice and smooth. There isn't any puffiness. There isn't a deep depression where there's actually some signs of volume loss there. But in some people where you've got this deep crease through here, which often catches a shadow, which triggers people to say, I'm really bothered by my dark circles or the puffiness under my eye, you can actually use injectable fillers to shorten the distance between the lower eyelid and the cheek, which in Jana's case, she actually has a really nice transition there, so she wouldn't need anything there. But sometimes when you get deflation of this central fat, which there's actually fat pads all scattered out throughout this entire part of the face through here. You've got different compartments, and those compartments will actually start to deflate, shift, and move down, which often makes people more aware of the ever-popular nasolabial fold, which then transitions down into the marionette lines. So these are all areas where often people have concerns, see areas that need improvement. So we can use, in the tear trough primarily, we use Restylane Silk. We use those products primarily because they're less hydrophilic in terms of hyaluronic acid-based fillers. They're less likely to bind water so readily, so they don't have a tendency to get puffy. Since the under eye area, the skin is very thin, so we don't want puffy under eyes as a result of trying to correct one problem. The products that we use in the central part of the face are products like Voluma, Restylane Lift. These products actually help to give a little bit of support, almost like little tent poles, to where you can actually reinflate these fat pads themselves, but you can also inject deep where you can actually get the tissue to lift up with the product up underneath it, which often gives a nice, soft, natural look, because you want to be deep enough to where you don't see the product. And when you're deep up against a bone, you don't see that. And usually with correction in this part of the face, you naturally get some softening of this nasolabial fold that people aren't very fond of. We don't typically like to fill the nasolabial fold because it's something that exists in everyone, even little kids. So we often like to fix the source of what's making this line look heavy before we go after chasing this. We do occasionally put a little bit of filler through here, and a filler that we would choose would be Juvederm or Restylane-based product, just to kind of soften those folds a little bit. Another area that often is of high concern is the area around the mouth. You have fat pads that are scattered all throughout the upper lip through here. In the actual pink of the lip themselves, they actually will deflate. People often say, my lipstick bleeds or my lips look like they've just deflated. You can actually inject the white part of the lip to restore some volume in the fat pads here, but you can also inject individual etched in lines that you see to restore volume and inject to smooth out some of those lines. It's not often that lines will all go away entirely, and that's not our goal. Our goal is to soften things to keep everything looking natural. And then you can inject the actual pink of the lip itself. And again, this is often an area that people are scared and hesitant to let you do, because over-injected lips look like fake lips. We don't want you to have fake lips. We want you to have your lips, but just a little bit softer. So you can inject these conservatively to where it just almost looks like they're really well hydrated. So they shouldn't look like you've got filler in there, just really nice and soft and luscious. And then you can use products in the upper lip like Juvederm, Restylane, Bellatero, Restylane Silk, which is a new product that we're really enjoying using in the white of the lip, the pink of the lip. It's very natural looking, nice soft. We use primarily hyaluronic acid-based fillers in all of these areas because these are areas that change over time, and you want products that change with an aging face because all of us will continue to age over time. And these products allow for some mobility. They dissolve slowly over time, and people are often bothered by the fact that this is something that you're going to have to maintain, but these products do stimulate some collagen production over time. It's nice to have some flexibility as things change in the face versus using more permanent type fillers or even semi-permanent fillers in this type of the face. There are some areas that we do use some of the semi-permanent fillers like Sculptra. We use Sculptra primarily in this part of the face here and along the jawline. You can use this here to build some subtle softening between the cheekbone and the jawline where people have a tendency to kind of get sunken. You can also use this product along with some of the other hyaluronic acid-based products in the temple to soften the transition from the forehead bone to the cheekbone. So the goal is not to eliminate facial contours. There should be natural curvatures in the face. There should be a natural flow from concavity to convexity, all of that throughout the face. It shouldn't just be one big round face. We don't want that. We don't want you to lose those contours. We just want to soften them so they transition really nicely. And with Jana, there are certain areas where you can use products that she doesn't need. There's a fat pad that actually lives in this brow. So sometimes people who feel like their brows are falling down and not interested in having surgery, there's not a lot of options. You can actually inject hyaluronic acid based fillers into that fat pad to actually get that to kind of bounce back up. You can also use hyaluronic acid based fillers to help with the contours of the nose. Some people have little dips and depressions or little bumps or natural asymmetries in their nose. So you can actually use soft tissue fillers in the nose to help, with different angles, just to help to soften the nose. She doesn't need anything like that. You can also use products like Voluma or Perlane in the chin. Perlane is now Restylane Lift. But you can use this to actually help give more projection to the chin. Some people don't like the way that their profiles look because their chin kind of sinks back. You can use those fillers to actually give the chin a little bit more profile, which is nice. And again, it allows just for flexibility to really shape the face and work with the face to give you nice, natural looking appearances. So, thank you, Jana.